Hello, my name is Dr. Shakita Hargrove, and I want to thank you for listening in on Heal from Trauma. The handout for this topic is available below this video or on the website. Let's get started. While navigating through Heal from Trauma, we're going to start by talking about trauma and what trauma is. Trauma is defined as a deeply distressing or disturbing experience. Trauma is an event, a series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or threatening, and that can have lasting adverse effects on the individual's functioning and physical, social, emotional well-being. There are various types of trauma. There are natural disasters such as hurricanes, tsunamis. There is sexual abuse. There is physical abuse. There is domestic and intimate partner violence. There's medical injury, illness, or procedures. There's community violence. There's neglect and deprivations. There's traumatic grief, dealing with the passing or the loss or the abandonment emotion. There is being the victim of a crime. There's kidnapping. There's accidents like car accidents. There's school violence, and there's this experience of loss. There's a variety of types of trauma. Trauma, when experienced, it attacks your identity. A person's identity is a self-portrait that's constructed of many pieces. For instance, your vocation or career, your political standing, religious or spiritual belief, relationship status, sexual identity, your ethnicity and culture, your personality, your physical identity. There are so many things or puzzle pieces that's a part of your identity. And when you experience a trauma, it attacks your identity. You begin to question who you are. You begin to question your strength, your religious beliefs, your sexual identity. You begin to question if you've chosen the right career. You begin to question your identity. And so, how does trauma attack or affect your identity? And we're going to discuss these three things within the topic today. So, we're going to deal with maladaptive behaviors, intrusive thoughts, and post traumatic stress. Maladaptive behaviors are those that stop you from adapting to new or difficult circumstances. They can start after a traumatic event, major life change, or illness. Maladaptive behaviors can be identified and replaced with more productive ones. If they are not replaced, they can lead to social, emotional, and health problems. And so examples of maladaptive behaviors that can become a self-destructive pattern are avoidance, which is continually avoiding something and not addressing the problem. Withdrawal, your go-to strategy to limit interaction, which results in isolation and builds anxiety. Passive aggressiveness, self-harm, such as cutting, picking at scabs, or pulling out your hair. Anger, which is that uncontrolled anger that doesn't resolve or solve problems. It alienates others and hampers your ability to communicate effectively. There's also substance use, and maladaptive daydreaming is when you engage in extensive fantasy in place of human interaction or participation in real life. They keep you from facing reality. Then there's intrusive thoughts. Intrusive thoughts are unwanted thoughts, impulses, or mental images that often cause significant anxiety, stress, and impairment within an individual's ability to function. These thoughts may surround the fear of committing an act, one considered to be harmful, violent, immoral, sexually inappropriate, or sacrilegious. Intrusive thoughts last longer and often return. A few disorders that are associated with intrusive thoughts are obsessive compulsive disorder and post traumatic stress disorder. So, post traumatic stress. This is a disorder and it is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. Most people who go through traumatic events may have temporary difficulty adjusting and coping, but with time and good self care, they usually get better. If the symptoms get worse, last for months or even years, and interfere with your day to day functioning, you may have PTSD. Post traumatic stress disorder symptoms may start within 1 month of a traumatic event, but sometimes symptoms may not appear until years after the event. These symptoms cause significant problems in social or work situation and in relationships. They can also interfere with your ability to go about your normal daily tasks. PTSD symptoms are generally grouped into four types: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. Symptoms can vary over time and vary from person to person. Doctors aren't sure why some people get PTSD. As with most mental health problems, PTSD is probably caused by a complex mix of stressful experiences, including the amount and severity of trauma you've gone through in your life, inherited mental health risk, such as a family history of anxiety and depression, inherited features of your personality, often called your temperament, and the way your brain regulates the chemicals and hormones your body releases in response to stress. And so we've quickly gone through what trauma is, and now I want us to talk about healing, becoming sound and healthy again. Becoming sound and healthy again. Heal. Become sound and healthy again. Alleviate a person's distress or anguish. And so while we're dealing with healing from that trauma, we're going to revisit on how to heal from maladaptive behaviors, intrusive thoughts, and post-traumatic stress. Maladaptive behaviors. If you've fallen into a pattern of maladaptive behaviors, you've taken the first step by recognizing it. Now you can make a conscious effort to change the way you react to things. Consider alternate, more productive behaviors to replace maladaptive ones. It will take some practice, so it's important not to slide into avoidance. Any conditions such as addiction or anxiety need to be addressed with the appropriate professional. Depending on your circumstances, treatment may include addiction counseling, anger management, cognitive behavioral therapy, exposure therapy, meditation, relaxation, and stress reducing techniques, and talk therapy. A lot of times, when dealing with maladaptive behaviors and working on healing from it, healing from the trauma that caused those behaviors, if you can talk with someone that you trust who can give sound advice, and if you can transition those negative behaviors to ones that are positive, you can break the cycle of committing or having maladaptive behaviors. Intrusive thoughts. So, ways to stop intrusive thoughts. Self care. A good step toward treating intrusive thoughts is recognizing what they are, just thoughts. You can learn to label them when they happen. Recognize they're not intent or desire, and then push them out. If you don't give yourself the time to engage with the thought will disappear. And cognitive behavioral therapy, acronym CBT. Talk therapy is a way for you to discuss the distressing thoughts with a mental health expert. You'll learn ways of thinking and reacting that can help you become less sensitive to the intrusive thoughts. In a controlled setting, your therapist may also expose you to triggers, which we'll talk about later, for your intrusive thoughts so you can develop healthy responses. And then there's also medication. A healthcare provider may prescribe you medication to help balance chemicals in your brain. This is common for conditions like OCD and depression. These drugs include antidepressants, selective serotonin reuptake inhibitors, and serotonin reuptake inhibitors. So it just depends on what method works best for you to manage those intrusive thoughts. And when we're talking about intrusive thoughts, they come randomly. They come because they're triggered. They come because you may have smelled something, seen something, heard something. It just comes out of nowhere as it may appear. But what you have to do is recognize that it's a thought and then replace that thought with something positive. Bring yourself into your now so that the thought that is of something of the past, that thought that is connected to that trauma does not linger in your mind, which causes you to have maladaptive behaviors, that causes you to exhibit symptoms of trauma. So you have to be able to recognize what an intrusive thought is and don't allow it to linger. Because when you don't engage with the thought, when you don't dive into the thought and try to remember everything that's associated with that thought will disappear. Post-traumatic stress. After surviving a traumatic event, many people have PTSD-like symptoms at first, such as being unable to stop thinking about what happened. Fear, anxiety, anger, depression, guilt, all are common reactions to trauma. However, the majority of people exposed to trauma do not develop long-term post-traumatic stress disorder. If you have disturbing thoughts and feelings about a traumatic event for more than a month, if they're severe, or if you feel you're having trouble getting your life back under control, talk to your doctor or a mental health professional. Getting treatment as soon as possible can help prevent PTSD symptoms from getting worse. Getting timely help and support may prevent normal stress reactions from getting worse and developing into PTSD. This may mean turning to family and friends who will listen and offer comfort. It may mean seeking out a mental health professional for a brief course of therapy. Some people may also find it helpful to turn to their faith community. Support from others also may help prevent you from turning to unhealthy coping methods such as misuse of alcohol or drugs. When you experience a trauma, symptoms may arise, such as fear, anxiety, guilt, aggression, pain, isolation, avoidance. Then you have the intrusive thoughts, the maladaptive behaviors. Those things, those symptoms can arise after experiencing a trauma. Oftentimes, those symptoms do not last long, depending on if you engage with the memory, if you engage with the thought, if you engage with the pain and all of the emotions that you've experienced from the trauma. It causes a bubble, it causes a cloud, it causes you to cocoon yourself in this traumatic experience, and you have to fight your way out of it so that you can have that sound mind, so that you can get back to your identity and maintain your security. And in order to do that, at times, it's necessary for you to find someone that you can talk to, that you can talk it out with. And if you don't have that personal person that you can connect to, if you don't have that individual from your faith community, such as your pastor or counselor or what have you, then it may be necessary for you to reach out to your physician so that your symptoms don't increase and become something that lasts for years or for an extended period of time. Because as we've already stated, when dealing with trauma, with trying to go through the healing process, it can take longer if you allow things to linger and not communicate to try to heal yourself from the experience that you had to endure. I wanted to make sure that I put this slide in because there are instances when a person's symptoms of trauma overwhelms them. And so if you or someone you know has suicidal thoughts, get help right away through one or more of these resources. One, reach out to a close friend or loved one. Contact a minister, a spiritual leader, or someone in your faith community. Call a suicide hotline. In the United States, call the National Suicide Prevention Lifeline at 1-800-273-TALK, which is 1-800-273-8255 to reach a trained counselor. Use that same number and press 1 to reach the Veterans Crisis Line, or make an appointment with your doctor or mental health professional. If you think you may hurt yourself or attempt suicide, call 911 or call your local emergency number immediately. If you know someone who's in danger of attempting suicide or has made a suicide attempt, make sure someone stays with that person to keep him or her safe. Call 911 or your local emergency number immediately, or if you can do so safely, take the person to the nearest hospital emergency room. And so let's talk about triggers, identifying what's opposing your life, what's coming against your identity, what's stopping you from breaking through the barrier to regain your security, your safety, to be more sociable, to be more personable, to pretty much gain your life back. Types of triggers can be placed into two categories: internal and external. Internal are your thoughts of lonely, abandonment, vulnerable, memories, emotions such as anxiety, sadness, anger, frustration, bodily sensations such as heart racing and muscle tension. External triggers can be situations such as smell, anniversary, holidays, a car accident, people such as an argument, end of a relationship, someone who reminds you of another, and conversation, as well as places, movie, or television show. How do you manage these triggers? There are healthy ways to cope with triggers, and those suffering can feel reassured that they don't have to give triggers power. When that trigger comes, you don't have to give it power to suck you back into that traumatic event. One of the most important steps to managing triggers in healthy ways is to be self-aware. Being self-aware allows for individuals to understand the driving force behind their behavior or the trigger before and after they react. Simple recommended methods to effectively manage triggers include exercising, resting, therapy or counseling, meditation or mindfulness, spending time with positive people, drinking water or tea for relaxation or hydration, joining a support group, eating nutritional meals, using positive distractions, and reframing negative attitudes or perceptions. Practices like mindfulness allow individuals to focus on right now, placing their mindset in the present moment. This encourages detaching from painful or distressing experiences and can reduce stress. Healthy ways of managing triggers allows individuals to thrive without turning to damaging coping mechanisms that can harm them or one of the resources mentioned earlier to aid in healing from trauma was to talk to someone in your faith community. Real quickly, I want to provide some biblical references for strategies and spiritual tools. So, strategies and spiritual tools. Here are some scriptural references that can help you battle back for soundness of mind, inner healing, assurance in safety, and secured identity. Soundness of mind. 2 Timothy 1:7. For God hath not given us the spirit of fear, but of power and of love and of a sound mind. So when those intrusive thoughts begin to come, battle back. Do not engage with those thoughts. Do not allow those thoughts to have power over you, nor let those thoughts win. Make sure you understand that God has not given you the spirit of fear, but He's giving you power, love, and a sound mind. And inner healing. Psalm 147:3. He healeth the broken in heart and bindeth up their wounds. When experiencing a traumatic event, there's pain, there's a sense of loss, there's a sense of heartache and heartbreak, depending on the kind of trauma that you've experienced, as well as who committed the trauma. And so Psalm 147:3 lets you know that the Lord heals the broken in heart and He will bind up your wounds. Assurance in safety. Psalm 4:8. In peace I will lie down and sleep, for you alone, Lord, make me dwell in safety. Sometimes memories come in dreams, in those maladaptive daydreaming, in the night terrors. And so it is good to meditate on the positive scripture and the word from the Lord that is saying to you in Psalm 4:8 that you will be able to lie down in peace and sleep in peace, because the Lord will make you dwell in safety. A lot of times when dealing with the healing process of a traumatic event, one will recognize that their physical safety, emotional safety has been disturbed. And so there's a sense of vulnerability, and also the sense of not being secured in your place. But when you know the Lord and have a relationship with Him, you know that He gives you a safe place to dwell in. He protects you under His shadow. And then going into secured identity. 1 Peter 2:9. But you are not like that, for you are a chosen people. You are royal priests, a holy nation, God's very own possession. As a result, you can show others the goodness of God, for He called you out of the darkness into His wonderful light. When dealing with trauma, trying to process it, trying to get back your identity, trying to find your place and quote unquote get back to you, it's knowing who your identity is in Christ and working your way back to that place of healing and security in your identity. So allow the Lord to pull you, to tug you, to draw you out of that dark place of depression, that dark place of anxiety, isolation, avoidance. Allow him to draw you out of that dark place and place you into his wonderful light. Allow him to heal you through the process. Don't combat the process of healing. Battle back. Don't allow trauma to win. Don't allow the maladaptive behaviors, the intrusive thoughts, the post-traumatic stress symptoms overtake you. Win in your healing. Win with the help of the Lord. And a lot of times, dealing with trauma, as stated earlier, because trauma can be categorized as internal and external. But real quick, I want to talk about internal battles. And so, Psalm 13:2. How long must I wrestle with my thoughts and every day have sorrow in my heart? How long will my enemy triumph over me? When dealing with trauma, you go through a grief process. You begin to experience loss. You begin to question things. You begin to analyze, how did things get here? How can I get out of this? Why do I wrestle with these thoughts? But then you go back to that verse that we talked about in 2 Timothy, that the Lord gives you a sound mind. Job 9:16 through 18 and 20 through 21. Even if I summoned him and he responded, I do not believe he would give me a hearing. He would crush me with a storm and multiply my wounds for no reason. He would not let me catch my breath, but would overwhelm me with misery. Even I were innocent, my mouth would condemn me. If I were blameless, it would pronounce me guilty. Although I am blameless, I have no concern for myself. I despise my own life. When you experience hardship, when you experience that traumatic event, you begin to question a lot of things. You begin to question, why did this happen to me? I did nothing wrong. I was an innocent person. I was minding my business, but this happened to me. What is going on? If I tell my story, no one is going to believe me. They're not going to do anything but judge me. And so what happens is you start having all of these internal battles. Internal battles. So as we discussed through Heal from Trauma, you have to heal from the inside out. You have to be able to find your source, find your voice, and begin to decree and declare your healing, your restoration, your victory in the midst of or out of this traumatic event. And you have to be able to understand that it is a process. And as it has been stated multiple times, don't engage with the intrusive thoughts. They are thoughts. And what happens is when you allow these thoughts to overtake you and overwhelm you, your identity is affected. Your identity is in Christ is being impacted, because now you're internalizing everything and you're not releasing the power. You're not releasing the connection. You're not releasing whatever spirits that's connected to the trauma. You're allowing them to abide and wrestle with your peace. And so manage your triggers. Isaiah 41:10. Fear not, for I am with you. Be not dismayed, for I am your God. I will strengthen you. I will help you. I will uphold you with my righteous right arm. When you're going through and experiencing traumatic symptoms, ask the Lord to help you. Seek him so that he may give you strength. Seek him so that he may protect you and uphold you. Seek him so that you will not be in a place of being dismayed, vulnerable, in a place of anxiety and depression, a place of darkness. Seek him so that he can help you. Reach out your hand, take him by his righteous right hand, and allow him to help you. And 1 Peter 5:7, casting all your anxieties on him because he cares for you. Have that moment, as it was stated before, in sources or steps or tools on how to heal. Meditate with the Lord. Have a talk with Him. Commune with Him and cast all of your cares and concerns, casting all of your anxieties, the things that have happened that has now limited your movement. Cast all your anxieties on Him, because trust and believe He does care for you. It is my hope that you were able to grab something from Heal from Trauma to assist yourself and another. Make sure that you download the handout and use it as a reference as needed.